guys want to see some real lungs and learn a little bit about asthma and what asthma does to your lungs when you're having an attack? These are pig's lungs, preserved pig's lungs. We use these because they're very similar to human lungs, about the same size, and as far as the structure and everything, it's all the same. So you can see actually on this lung, this main pipe that comes down that first airway is called your trachea. That's the windpipe, and then it splits actually into two sides, your left and your right, and those where it splits are called the main stem bronchi. As it goes down, it'll travel through the bronchioles, and the airways just keep getting smaller and smaller and smaller, all the way down to the air sacs, which are known as the alveoli. So as I inflate these, you can actually see those alveoli expanding. You can see them getting bigger. Now the alveoli, that's where oxygen that you breathe in gets into your bloodstream, and the CO2 that's coming back from your cells gets back out. So that's how we breathe in and out. Now, around all those airways are muscles, and when you're having an asthma attack, those muscles act like rubber bands, and they're going to constrict, they're going to tighten down, and it's going to make it harder for you to breathe. So as you're trying to breathe while you're having an asthma attack, the lungs just aren't going to be able to inflate as well. So you're going to start to feel short of breath and start to have some of your signs and symptoms that you would have with an asthma attack. So it'll make it a little harder to breathe. Since we can't look inside of our pig's lungs here, I actually did bring a model, so you can actually kind of get an idea of what's happening when your lungs start to change during an asthma attack. What you're going to see first is actually called muscle spasm or bronchospasm, that the muscles wrapped around there are going to tighten up, and it's going to narrow the airways, making it harder for the air to get down in. So if you look at the model, you can actually see that those airways get tighter. The other change that occurs with an asthma attack is swelling or inflammation. The airway wall is actually going to get thicker, and it's going to also cause the size of those airways to be narrowed. And again, that's going to make it harder for you to breathe. The third change that you have is actually mucus. So as you're having an asthma attack, your body's making mucus because it's trying to get rid of whatever's causing your asthma to occur. So you're going to have all that extra mucus. It's going to make it, again, more difficult to breathe. So with all three of those things occurring, everything's going to happen, and it's going to make you short of breath. What a normal airway should look like, it should be nice and open. So you can see on the normal one there that there's no mucus, there's no tightness with that bronchospasm, and there's also no inflammation. So all that's going to make it easier for you to breathe. When these changes start to occur during your asthma attack, you're actually going to start to develop warning signs. And these can be things as simple as a cough. So you might start to cough, or you might start to wheeze. Not every patient or not every person with asthma is going to wheeze. Sometimes it's a cough, sometimes it's a headache, sometimes your heart starts to beat fast. Sometimes because of all that mucus, if you swallow it, it's going to give you an upset stomach. Sometimes just looking, if your friends know that you have asthma, or your parents, they can sometimes look at you and just know that something's not quite right. So you can actually start to see that you're having an asthma attack before you actually have any of these really bad changes occurring. The key there is recognizing early warning signs. You can treat your asthma sooner and keep it from becoming a severe attack. So you can actually recognize those warning signs and then be able to take better care of yourself.
Remember, when you have an asthma attack, your airways change. The three changes include the muscles around the airways tighten, inside walls swell, and there's an increase of mucus. Know your early warning signs and record them in your asthma action profile.